All right. Okay, can you guys hear now? Putting the microphone on. Can't hear me still. Let's see, the black one.
They're all long.
Connected to the black one. All right. I think we fixed the sound issue. There's a little bit of delay. Pammy, what's up, Pam? Hi. All right. Oh, still no sound? Oh, you on. Okay. Give me a wave if you guys can hear me. Yes. All right, cool. All right, so you guys, we're going live, and we're going to talk about a BBL trend. Is it over, you guys? This is really popular right now. I'm just going to adjust these lenses so that everybody can see me. I'm in the operating room right now. We didn't do any surgeries today. Let me get this one a little bit closer. And we're going to dive in. Has anybody had a BBL? Let me know. What's up? And let's tighten this right here. We got this like three-prong thing. Kind of like.
Do you want that one?
Yeah, it's kind of like a. It's kind of like a. Oh, that's perfect.
Cool.
Yeah, it's like one of those like mythical monsters with the 3 heads. Just like. Rah! Okay. So, all right. So we're here. You want one, Jasleen? Come see me. We are still doing BBLs, okay? I don't think the trend is over. The trend is very well on its way to being probably one of the most popular procedures. Okay, now, but what's happening is people are getting away from that over-exaggerated look. Now, if you guys follow the Kardashians, a lot of us hate them. I think they're great people. Kim and Khloe have both been spotted with dramatically reduced backside BBL reversals. Okay, we don't know specifically if they actually had surgeries, but they appear a lot slimmer. Their butts don't look as big as they used to, and this can be done through diet and exercise. What do you think? You think they're doing it all through diet and exercise, or do you think there's something else going on here? So my thought is that they could have had a BBL reduction, or they could have had a BBL reduction and removal of buttock implants if they had them, okay? So a lot of the pictures I've seen, it looks like, I'm just tilting this one down a little bit. And I'm gonna tilt this one down. Our recent TikTok, you can actually see me talking about the Kardashians and what's going on with Kim. Why is she so skinny? We don't know any of this stuff. Everybody's just speculating at this point. But if they are the trendsetters, they're going for a much more natural look, a more slimmed down look. But I want to know, what do you guys think? You think it's a good thing? I personally think it's a good thing. I think it's good to kind of stay within the confines of a normal, natural looking body shape and form and function. If your butt's too big to fit in an airplane because you made it that way, I don't think that's a good idea. A butt does serve a function. You need to pass through doors, you need to sit on things, you need to, fit into clothes. If it gets way too big, it could cause problems, and it's just annoying. So there's a lot of different BBL terms. Forever Young BBL, Country Club BBL. What is a Country Club BBL? I want to see this. Nujan told me, talk about Country Club BBL. What the hell is a Country Club BBL? I think Enhanced Natural Pro Surgery. Yazzie, thank you very much.
It's close to a skinny BBL.
It's close to a skinny BBL, so it's Country Club BBL. So I don't know. There's some connotations there. I don't know if we like those. BBL types: natural BBL, over-the-top BBL, skinny BBL, hip dips filled. So let's talk about BBLs. All right. So basically, what a Brazilian butt lift is we're taking fat from where you don't want it and transferring it to the buttock area. Now, there's probably about 7 distinct regions of the buttock that can be filled with fat. Many of the times when I do them, I'm generally just trying to fill all around in all of these various areas, and sometimes shaping in a way to make a more rounded version of the buttock or fill in hip dips. I have some patients that just have hip dips. That's where all the muscles attach right here on the hips, and they just want that area filled. Okay, so that's pretty common. So or some people are like, as a side thing, we're doing liposuction of the abdomen and the flanks, or we're doing a tummy tuck. Why not take the fat and put it somewhere? So sometimes people put it in the breast, but a lot of people put it in the buttocks. My question for you is, how many 80-year-olds do you see with a banging butt? Just amazing kick-ass booty. How many? If you find one, please let me know, because they don't exist. So if you have the fat, that's what I tell people. It's like if you have the fat, put it somewhere. Because as you get old, you don't see fat old people. Old people, as they get older, their genes change unless we can kind of figure that out, and they stop eating and they get skinnier and skinnier and skinnier. Okay, if not, if they're fat, they're just unhealthy and they die. So if you want to be kind of looking good when you get older and you're going to get a liposuction procedure, might as well put that fat somewhere in the buttock area. It's my thought. Okay. All right. So I do think the tide is shifting. We're getting away from this over-the-top BBLs where people are getting 3 or 4 rounds. You know, the death rate for a Brazilian butt lift is 1 in 3,000 nationwide. That's something that people are waking up to. People are going overseas sometimes and dying. People are here in this country are dying. There was an influencer that died in Colombia, I think last year. I talked about that. Super tragic. I'm not exactly sure what happened, but you know, our plastic surgery specialty has guidelines on how to do Brazilian butt lifts that's extremely safe. Knock on wood, I've never had anybody die, and I stay very superficial. I don't get into the muscles. I don't go subfascial, right? So let's talk about what makes a BBL dangerous. You have muscles and veins in your buttock area. Okay, we have gluteus maximus, gluteus minimus, and gluteus medius. Those are 3 gluteal muscles. Within them, these are big muscles. They have big arteries and have big veins. So on top of those muscles is a fascial sheath, okay? That keeps it pretty separate from your fat that makes up the rest of your buttocks, okay? So as long as you stay out of that muscle area, there are no really reported cases of death from a fat embolism, all right? So when you have a doctor that purposely violates that muscular area, yes, you can get a bigger result from it. You are jeopardizing that patient's health because you're creating a high pressure environment in that subfascial plane where the fat can enter in a vein, especially if you damaged it, and go to your heart and then to your lungs. The problem with fat, when it goes to your lungs, it stops the blood supply to your lungs and you can die. Or you can have a pulmonary embolism, which isn't fun either if it's a small one. All right, so that's why it's really important, if you're going to get this procedure, to go to someone like myself that's board certified plastic surgeon, that's, you know, well, with a good reputation that does these procedures, so that you can make sure that you don't die. All right, that's the last thing that any of us want. But there's these places, if you're going to somebody's garage to get this done, you might want to think twice. If you're going to save money somewhere by going across the border, again, those places, I know there's a lot of debate about this. Yes, there's good doctors in Mexico, but do they have the same standard as the United States do? Does the board certification process the same as it is here? No, it's not. That's the bottom line. So you're kind of gambling with your health if you're looking to go and get this procedure cheap somewhere. And the problem is, if you get plastic surgery overseas and you come back and you have a complication, where do you go if there's a problem? Okay, just so you guys know, I'm in Beverly Hills. You can check out my website, drdanielbarrett.com. We have virtual consultations there where you can just submit some information. So drdanielbarrett.com. Check out my YouTube, guys. It's Dr. Barrett Plastic Surgery YouTube. My Instagram, we have stories going up today of some surgeries. It's Dr. Daniel Barrett. And then, of course, we have TikTok, which is Barrett Plastic Surgery. That's where we have a lot of fun. Got 1.8 million subscribers there. That we put out a lot of fun stuff. So, all right, let's finish up. Let's keep talking about BBLs. So, you know, the cost of a BBL. You guys ready? Let's talk about pricing. What does it cost? What does it cost in the United States? It costs anywhere from $8,000 for a small area of liposuction, maybe abdomen, flanks, and fat trims to the buttocks, all the way up to $30,000, $35,000 if you are doing whole body liposuction and adding on Sculptra, okay? It also depends on where you go. If you go into Beverly Hills, it's going to be a little bit higher. Our rent is higher, but our service is also very high here as well. We do provide excellent service for all of our patients. We see our patients a lot, but that's what you're looking at in terms of a safe price, okay? $8,000 all the way up to $35,000. And it depends on what areas you're trying to get fat from. Now, you want to make sure that you have enough fat. If you don't have enough fat, then sometimes we have to boost it, and we could boost it with filler products like Sculptra or Renuva. I believe that's the newer product. It's like a fat substitute, but this is where it gets really expensive. Those products, first of all, they don't last forever, and they cost anywhere from like $300 to $400 a vial. Okay, so If you need like 12 vials, that's going to cost a fair amount of money. But the advantage of that, if we just do the injectable, is that you don't have to go to sleep, or you don't have to go under anesthesia. But the disadvantage is that it maybe lasts 5 or 6 years, versus your fat lasts forever, hopefully until you're 80, and then you can send me a picture. Okay. All right. So what happens if you've gone too big? So I've actually been increasingly getting a lot of patients who've had a BBL that was way too big, or they've gained weight. Now remember, fat has memory. So if you get liposuction, it doesn't make your body look weird if you gain weight. You just gain less weight wherever you have liposuction. So that's a common myth. But where you do gain more weight is where you put the fat. So if you typically gain weight in your abdomen and your flanks, and you transfer that fat to your buttocks, when you do gain weight, it's going to go to the buttocks. So a lot of times that happens, and we have to go in and gently remove the fat. Now it gets kind of tricky, because you don't want to disturb the structure support mechanisms of the buttocks. So I generally stay away from the banana roll on the bottom part of the breast, and I just try to take off overall on the booty side, top side, and the sides. Generally, we leave the hip area alone, because that's always the toughest area to fill, is the hip dips. That typically works. I go down into multiple different planes, but we have some videos on my YouTube channel you guys can check out at Dr. Barrett Plastic Surgery YouTube, where we do BBL reduction. Okay, so that's it, guys. Let's go into your questions. Laura, thanks for thinking me funny. Appreciate that, Laura. Luska. All right. Let's see what questions you guys. Is there an age limit when you should not have plastic surgery? Amber, not really. I mean, you got to define plastic surgery. If you're 10 years old and you're trying to have a breast augmentation, it's probably not a good idea. Dr. Barrett, would you get a BBL? Please talk about male definition BBL. So I do get a lot of men who want BBLs, but it's a different type of BBLs. And yes, I would if that were my goal. Right now I'm actually trying to get a lot of muscle definition, because I do a lot of distance training. I don't really have a whole lot of fat, so I'd have to use like Sculptor or something else. But when it comes to female BBL, you want more of an hourglass shape. When it comes to male sculpted BBLs, you want posterior projection. Okay, you want a V shape typically for most males, unless a male wants a rounded, more hourglass shape, which we can do. But typically in a male BBL, we keep it narrow, but projection in the back, so it's kind of like a little bubble butt. What happens to the fat in your butt when you get older? Swan lash and browler, it gets smaller. Okay, again, like we said, as you get older, you're 90 years old. How many 90-year-olds do you see with a banging booty? Very few. So the main reason why is because as you get older, your appetite decreases and you just stop eating. So and you stop working out, everything atrophies, your brain atrophies, everything atrophies. So they're working on ways to keep your genes turned on. That's one thing. Like a lot of people take NAD, that's a molecule to kind of do that. And then there's some hormone replacement stuff, which gets even more complicated. We'll have to do a separate live to even talk about that. Okay, I had a history of factor V Leiden in the past. Should I take a chance for plastic surgery? Yes, we actually have patients with factor V Leiden, and we give them blood thinning medication and make it safe. Okay, if it's really bad and you're getting blood clots frequently, then maybe you want to think twice, but you can definitely shoot us an email or check out our virtual consultation page on Dr. Daniel Barrett, and we'll get back to you. If you have HA, hidradenitis suppurativa, can that cause complications if you have scarring? You want to remove them and place fat transfer indentations. So I actually one of the few docs that does a lot of hidradenitis resections. Typically we have to do a skin graft to cover the damaged area. Hidradenitis suppurativa is a chronic infection of like the armpit or the groin area. It's very debilitating. I've had a lot of patients that have dramatically turned around. I had one young man who's now able to go to grad school because we cured his HA. So that is something that can be fat grafted, but the big part of that goal is to stop it from happening again, take out the diseased tissue, skin graft, and you can do fat transfer later. All right, are people really removing the BBLs? Yes, they are. They're calling us, we're doing it here. They're not so much returning it or removing it, they're just toning it down. It's like, same thing with people's breasts. So yesterday I had a wonderful patient, she got 400cc implants about 4 years ago. I told her at the time it's too big. She's like, I want to do it. I'm like, okay, fine, we'll do it. But then she's like, all right, you're right. Let's take them out. Let's tone it down. So I always try to kind of keep tone down people when they come in. They're like, I want this. Ultimately, it's your body, your choice. But I see the whole spectrum of people. But yeah, it's like someone who goes out and buys the the V8 Mustang and gas prices go up. Like, oh damn, I gotta cool it. The economy's going down and gas prices are going up. So I'm gonna trade it in for the Prius. You know what I mean? So we do. Yeah, I guess that's my take on it. But again, if you like your butts to be really big, I mean that's totally fine, and that's somebody's choice. I think it's a relatively safe thing to do to your body, and that's life is short. If that's what you want to do, go for it. All right, we have a few more questions, you guys. Are there any good thread lifts? Not for the buttocks. Thread lifts really aren't the best thing for buttocks. Dr. Barrett, those BBL procedures better or just dangerous if I place implants in the buttocks? I think a fat transfer BBL procedure is a safer operation than implants in terms of complications. The death rate is lower for implants, but the complication rate is higher for buttock implants. There's a big scar that you have to have on the butt crease to have buttock implants, and you have to sit on your butt. So it's a very difficult area to have an implant, and it can rotate, it can do weird, funky things. Google butt implants gone wrong, and you will see what I'm talking about. Fat generally looks good every time I put it. A couple things to talk about. If you are to get a BBL, we typically will put you in one of these, but it has a little bit of a spacer in the back because you don't want to sit on your butt. We would also do the same, something similar with compression if you had a reduction or liposuction in general. And then also, if you're going to get a BBL, we have a little special cushion that you sit on with your hamstrings so that you can sit down and recover from your BBL, because you don't want, the theory is, you don't want to put pressure on the buttocks where you transfer the fat for 2 weeks. That way the fat has the best chance to survive. Okay, Raquel, so recovery time, that's a good question. Recovery time from a BBL is approximately 2 weeks. Can you go back to work in 4 days? Yes, if you have a desk job, but you can't sit on your butt for more than maybe like a couple minutes. So my suggestion is to get the special pillow that we provide all of our patients. We actually have it on our website, postoprecovery.com. If you are getting a BBL and you don't know what pillow to get, this is great. It's a hamstring pillow. It goes underneath your hamstring so you can sit at work, do your job, and then go through at least 2 weeks. Some doctors don't want you sitting in your butt for 6 weeks. Yes, Nicole, we do BBLs for trans patients all the time. It's very popular. So 2 weeks so you can start sitting in your butt, but you won't probably see the full results until about 3 months. Your butt's going to start out big, and then that fat's going to slowly get absorbed. We lose about 30 to 40% of the fat that we transfer. So when you come out of surgery, if you think your butt's too big, don't worry, it goes down. And around 3 months is when you'll kind of see that. Okay, we'll answer a couple more questions for you guys. We're going to talk about rhinoplasty very soon, you guys, and then. Is there an expiration date on saline implants? No, but they could have mold in them and they could rupture, and then that's a big problem. All right. And let's see. Great. I think that's it, guys. You got all your questions. Brittany, you're asking about the BBL, the death rate. Yes. Again, my suggestion is to go to a board-certified plastic surgeon. Don't go overseas to get this procedure done. It is a very dangerous procedure in the wrong hands, okay? I want you guys to check out my YouTube page. I've got the best videos on this, everything you need to know on my podcast, Natural Plastic Surgeon Podcast. So if you want to listen to everything you need to know about BBLs, if you're thinking about getting this done, go to my Natural Plastic Surgeon Podcast. It's on Apple, it's on Spotify, and you can listen, download everything you need to know about BBLs. I forget what episode it is. You guys know what episode it is?
44.
44?
44 is next.
Yeah, release.
No, what's our everything you need to know about BBLs?
Oh.
Yeah. So I'm going to get that episode number for you. You can actually scroll through it, but that's going to give you. You could also check it out on my YouTube. I actually have everything you need to know about BBLs, where we go in depth. Episode 26 is where we talk about everything you need to know about BBLs, and that's on my Natural Plastic Surgeon Podcast. So if you go to your little podcast, if you search podcast on your iPhone, go there, subscribe to Natural Plastic Surgeon, check out episode 26, and then you'll see everything you need about BBL. Also, it's on my YouTube as well. You can check out my podcast page there. I have a whole library of all my podcasts that I've done, so you can see me actually talking about it versus listening to it. But if you're not letting you sitting in traffic, it's a great thing to listen to on your way to work. All right, guys, that's it. Thanks for watching me. Make sure you check out my YouTube, Dr. Barrett Plastic Surgery, and Dr. Daniel Barrett on Instagram. And then for those of you who want to see some fun stuff on TikTok, Barrett Plastic Surgery. Thank you, guys.